you are testing the superior rectus. When you ask the patient to elevate the eye in adducted position, you are testing the inferior oblique muscle. When you are asking the patient to depress the eye in an outward position or abducted position, you are basically testing the inferior rectus muscle. If you ask the patient to depress the eye and in adducted position, then you are basically testing the superior oblique. So when you are testing the superior oblique, you ask the patient to converge both the eyes down. You're looking at something. You are testing the superior oblique muscle, and that's why when when you have superior oblique paralysis, you ask the patient to go down the stairs. You start to have diplopia because he needs to put both the eyes down. So as he is going to put both the eyes down, he starts to have diplopia because of the superior oblique paralysis. Or when he tries to, looking at forward and then you give him something to read and he has to converge down, he starts to have diplopia. So this is a characteristic sign to test the superior oblique muscle. And if there is a superior oblique paralysis, then when they pull their eyes down and converge them, they start to have diplopia because both the eyes are not going to be at the same level. One eye would be up, one eye would be down. So these people usually tilt their head. So to bring their eyes at the same level to overcome the diplopia. Yes?
Isn't the inferior oblique responsible for down and outward?
Yes, the action of the superior oblique is downward and outward.
Not onward, but just across.
Abduction is the secondary action. But when you are testing the superior oblique, you need to put the eyes into an adducted position, so to test it. So when you start to ask the patient to put the eye downward and inward, it starts to have diplopia because one eye would be up and the other eye would be down.
What happens when they tilt their head going down?
Yeah, then both eyes would start to come together, so they would be overcoming the diplopia by tilting their head.
Which muscle would they use when they're tilting their head?
Tilting their head would be just according to the amount of the level where one eye is a little bit above the other one, for the visual axis in the same line. So this picture which you are seeing is the action of the muscles. So this is not how you are going to test. So if you are going to see this, you are basically looking at the action of the muscles. So, but there is a picture in your book which is basically giving you how you are testing the muscles, and that would show you a totally opposite picture. So don't get confused with that picture. What they are doing is cancelling out the secondary action of the muscle. Yes?
You said that when we're testing the superior rectus, we ask the patient to look laterally and superior.
Okay, yeah.
In the top right picture, that's what they're doing.
Yeah, it's wrong.
Yeah.
Listen,
Superior rectus.
superior rectus is looking laterally and superior.
It should be abducted.
Yeah, so this is fine. So this is basically testing.
These are the tests, right?
This is a testing.
This is testing.
This is the testing one.
This is testing. But look at
Yeah, this is the testing one. Okay. What else I have here? The nerves we have already talked about. What you need to also understand is that oculomotor nerve, once it comes into the orbit, it divides into two divisions, a superior division and inferior division. The superior division of the oculomotor nerve supplies the superior rectus muscle and the levator palpebral superioris. The inferior division is going to supply the inferior rectus muscle, it is going to supply the inferior oblique muscle, and it is going to supply the medial rectus muscle. And this inferior division also have the ciliary ganglion. So parasympathetic supply is also going through the inferior division of the oculomotor nerve. So there are two divisions of the oculomotor nerve. The superior division is supplying the superior rectus and the levator palpebral superioris. Inferior division is going to supply the medial rectus, inferior oblique, and also the ciliary ganglion. So parasympathetic supply is also going through the inferior division of the oculomotor nerve. The nerves, you can see it here. The major vessel which is coming into the the orbit is the ophthalmic artery, and you can see the branches of the ophthalmic artery which are coming here. The lacrimal artery, you can see the short ciliary artery, the nasociliary artery. So these are the vessels which are coming out from the ophthalmic artery. The major artery which goes with the optic nerve is the central retinal artery, which runs in the optic nerve and enters into the eyeball. So these are the branches of the ophthalmic artery. I'm not going to go into all of these branches. You can just see them here. There are 11 branches of ophthalmic artery, and these are the veins. Okay. There are some cases also given at the end of the session to allow you to go through and see how we are going to ask you questions. So some of these cases are given as an example of what type of things you need to focus on, and